Last year we came to Natsap and presented about the final regulations of the Federal Mental Health Parity Act, which went into effect in July 2014. At the time of last year's conference, we were really excited about these new laws and the new opportunities that they provided. The final regulations very explicitly stated that intermediate levels of care, including residential treatment, were required under the Federal Mental Health Parity Act. So it's been about a little over 2 years, a year and a half since the final regs have come out, and in that time we've also seen the implementation of the Affordable Care Act, which require insurance plans to have adequate provider networks, including provider networks of residential treatment centers. And the exciting thing is what we've seen is that health plans are doing what they're supposed to do, and they're building their networks. So what this means for families is when they're in crisis and they're looking for a placement for their child, their first stop is now going to be their insurance company. They're going to now have the expectation, which they previously didn't have, that their insurance company is going to help pay for their residential treatment. And probably their first stop is going to be to look at which facilities are in network with their insurance company. Now, people with really generous PPO plans will have the option to look out of network and have their pick of residential treatment facilities, but they're going to need to pick facilities that are acceptable even on an out-of-network basis to their insurance company and meet certain criteria. So what this means for all of you administrators and executives at residential treatment centers is that the time has come to start working with insurance companies, even if you don't want to. Now, in our talk, we're going to explain there's varying levels that you can work with insurance companies. The most involved would be to go ahead and get in the network with the insurance companies. And if you choose not to take that route, we'll explain the requirements that you need to meet in order to be an acceptable out-of-network facility, and that both routes will require facilities obtain pre-authorization with the insurance companies prior to admit and do ongoing utilization review, and we'll explain how that will work. So the title of our talk is Time to Face the Music: Why RTCs Need to Find Ways to Work with Insurance Now. And it's a good thing. These are good laws. We're happy they're here, and now it's time for the facilities to do your part in helping families get the financial coverage of this treatment. And I'm going to pass this over to my colleague Karen.
Hi, I'm Karen Fessel. We are working, some of the things that we're going to discuss in greater detail are what exactly the plans are requiring. If you're looking for an accreditation agency, it's best to go with Joint Commission, because some of the plans require Joint Commission accreditation. We'll talk a little bit about billing. It's actually easier to bill because than for clinical treatments only, because you get a per diem rate and you just list the range of dates that the child is in the facility. We're going to talk a little about considering getting your facility licensed for lower levels of care, partial hospital and intensive outpatient. Sometimes facilities can serve as their own step down, and this is very useful because the teenagers often they're not ready to be discharged, and they continue to need some level of care. So it's a good compromise, and we look forward to presenting. Thank you.